Today we're going to talk about the immune system. Many types of viruses, bacteria, and protozoa are human pathogens, or organisms that cause disease. Immunology is the study of internal defense mechanisms. The immune system's purposes are to protect the body from disease and infection and give the body immunity. The human body has both external and internal defenses against infection. External defenses include the skin, mucous membranes, hair in the nose and ears, keeping the skin clean, and good oral hygiene. Internal defenses include the immune response and antibodies. Immunity is when a person has protection against a disease or condition. An immune response involves the recognition of foreign or harmful molecules or abnormal cells and an action aimed at eliminating them. Immune responses depend on communication among cells referred to as cell signaling. Cells of the immune system communicate directly with their surface molecules and indirectly by releasing signaling molecules. The two main types of immunity are specific immunity or adaptive immunity and non-specific immunity or innate immunity. Both types of immune responses depend on the body's ability to distinguish self from non-self. That is, to distinguish itself from pathogens that infect it. Specific immunity is the body's reaction to a certain threat. Specific immunity provides very specific responses against specific foreign molecules that have gained entrance to the body. Adaptive immune responses take longer to launch than innate immune responses. Specific immunity also involves immunological memory. This system remembers foreign or dangerous molecules that it encounters. It allows the body to respond faster and more efficiently when it encounters the same molecules again. Specific immunity is the job of the lymphatic system. Non-specific immunity is the body's reaction to anything that it does not recognize as a normal body substance. Non-specific immunity provides immediate general protection against pathogens. These responses prevent most pathogens from entering the body and rapidly destroy those pathogens that do penetrate the outer defenses. Any molecule that can be specifically recognized as foreign by cells of the immune system is called an antigen. An important adaptive immune response is the production of antibodies, which are highly specific proteins that recognize and bind to specific antigens. There are different cells and substances that produce immunity. Antibodies are normal body substances that recognize other substances. They are involved in destroying abnormal or unwanted substances. They're also known as immunoglobulins. Antigens are substances that cause an immune response. Antibodies recognize and bind with unwanted antigens. This leads to the destruction of unwanted substances and the production of more antibodies. Phagocytes are white blood cells that destroy and digest microorganisms and other unwanted substances. Lymphocytes are white blood cells that produce antibodies. Lymphocyte production increases as the body responds to an infection. When the body senses an antigen from an unwanted substance, the immune system acts. Phagocyte and lymphocyte production increases. Phagocytes destroy the invaders through digestion. The lymphocytes produce antibodies that identify and destroy the unwanted substance. Innate immune responses. Our first line of defense is our skin, the outer covering of the body. Skin and other barriers stop most pathogens from entering the body. When pathogens do succeed in penetrating the body, the immune system responds quickly to destroy them. Mechanical and chemical barriers prevent pathogens from getting into the body. For instance, the skin and mucous membranes that line the passageways of the body prevent most pathogens and other harmful substances from entering the body. Pathogens that enter the body with inhaled air may be filtered out by the hairs in the nose or trapped in the sticky mucus lining of the respiratory passageway. Bacteria that enter with food are usually destroyed by acid and enzymes of the stomach. Phagocytes destroy bacteria and other foreign matter, and natural killer cells destroy cells infected by viruses and destroy cancer cells. Phagocytes are cells that ingest and destroy bacteria and other foreign matter. In phagocytosis, a cell flows around a bacterium and engulfs it. Neutrophils, the most numerous type of white blood cell, and macrophages are phagocytes of the immune system. Natural killer cells are large, granular lymphocytes that are produced in the bone marrow. These cells recognize and are active against a large number of targets, including cells infected with some viruses and tumor cells. Natural killer cells release cytokines. Cytokines are a diverse group of chemical compounds that help regulate the immune response. Dendritic cells are stationed in tissues that are in contact with the outside environment. The skin, the epithelial linings of the respiratory, digestive, urinary, and vaginal passageways. These cells are activated by certain proteins on the surfaces of viruses, certain bacteria, and fungus. They destroy target cells by both innate and adaptive immune response. Again, cytokines are a diverse group of mainly peptides and proteins that cells use to signal one another. They help regulate the duration and intensity of the immune response. During inflammation, cells release cytokines that signal the immune system to launch an adaptive immune response. When infected by viruses, cells secrete cytokines called interferons. Interferons interfere with viral replication. Another type of interferon stimulates macrophages to destroy cells that have been infected by viruses and to destroy tumor cells. Macrophages and certain lymphocytes release interleukins and tumor necrosis factor that defend the body against infection. Complement is a group of proteins that destroy pathogens. Complement complements the action of other immune responses. Once activated, proteins of the complement system destroy pathogens. Finally, the inflammatory response brings large numbers of neutrophils and other phagocytes into the injured area. When pathogens invade tissues, an inflammatory response develops within a few hours. The clinical characteristics of inflammation are heat, redness, edema, and pain. The inflammatory response is regulated by proteins in the plasma, by cytokines, and by mast cells, which are large connective tissue cells filled with granules. The function of the inflammatory response is to bring large numbers of phagocytes and proteins to the injured or infected area. The inflammatory response consists of three main processes: vasodilation, when mast cells release histamine and other compounds that dilate blood vessels in the affected area. Vasodilation allows increased blood flow to the infected region, bringing great numbers of neutrophils and other phagocytic cells. Next, increased capillary permeability. Histamine and other compounds released by mast cells also make capillaries more permeable. Fluid carrying antibodies moves out of circulation and into the tissue. Finally, increased phagocytosis. Large numbers of neutrophils migrate out of the permeable capillaries and into the infected tissue. The two main types of specific immunity are cell-mediated immunity and antibody-mediated immunity. In cell-mediated immunity, T cells attack invading pathogens directly. T lymphocytes attack body cells by invading pathogens, foreign cells such as organ transplants, and cells altered by mutation, or cancer cells. T cells originated from stem cells in bone marrow. On their way to the lymph tissue, T cells stop off in the thymus gland where they mature. The thymus makes T cells capable of making immune responses. As T cells move through the thymus, they divide many times and develop specific surface receptors called T cell receptors. Several types of T cells have been identified. Cytotoxic T cells, also called killer T cells, recognize and destroy cells with foreign antigens on their surfaces. Killer T cells target virus-infected cells, cancer cells, and foreign tissue grafts. Helper T cells secrete cytokines and activate B cells. Regulatory T cells suppress immune responses after pathogens have been destroyed. Some T cells remain in the lymph tissue as memory T cells for years or even decades. If the same type of pathogen ever attacks again, the memory cells quickly go into action. Instead of going out to meet the invader, like T cells, B cells produce specific antibodies. B lymphocytes are responsible for antibody-mediated immunity. Millions of B cells are produced in the bone marrow daily. Each B cell is genetically programmed to produce and display a specific type of B cell receptor that binds with a specific type of antigen. Most activated B cells mature and become plasma cells, which secrete antibodies. Unlike killer T cells, plasma cells do not leave the lymph nodes. The antibodies that the plasma cells secrete are carried by the lymph to the blood and are transported to the infected region. Some of the activated B cells become memory B cells and continue for years to produce small amounts of antibodies. Should the pathogen ever enter the body again, the circulating antibody immediately binds to it. After they leave the bone marrow and thymus gland, B cells and T cells reside inside the spleen, lymph nodes, tonsils, and other lymphatic tissues. NK cells destroy virus-infected cells and tumor cells. They are important in innate immunity. Antibodies are grouped into classes according to their structure. The abbreviation Ig is used for immunoglobulin. There are 5 classes. The principal job of the antibody is to identify a pathogen as foreign. It does this by combining with the matching antigen on the surface of the pathogen. Typically, several antigens combined with several antibodies. They form a mass of clumped antibody-antigen complex, which may do the following: inactivate the pathogen or toxin, stimulate phagocytes to destroy the pathogen, or antibodies of the IgG and IgM groups work by activating the complement system. Normally, about 75% of the antibodies in the body belong to the IgG group. IgG is found in the blood and other body fluids. It protects against bacterial and viral infections. IgM is the initial antibody produced by a specific immune response. IgA plays a pivotal role in mucosal homeostasis of the GI, respiratory, and urinary tracts. IgD enhances immunity by releasing immune-activating, pro-inflammatory, and antimicrobial factors. Finally, IgE mediates allergic reactions. A primary response occurs the first time a person is exposed to a particular antigen. With primary response, approximately 3 to 14 days are required to mobilize specific T cells and antibodies. With secondary response, this occurs with a second exposure to the same antigen. Secondary response is much more rapid than primary response. Memory T cells quickly become killer T cells and produce interferon and other substances that kill invading cells before a person develops the disease. Memory B cells multiply and rapidly increase antibody production. Because of the memory cells, we do not usually become ill from the same type of infection more than once. However, even a slight change in an antigen can prevent memory cells from recognizing the pathogen. The body treats each different antigen as a new immunological challenge. Active immunity is typically developed naturally following an infection or exposure to an infection. It can be artificially induced by immunization. With active immunity, the body launches an immune response to antigens on the pathogen and produces memory cells. Immunization refers to vaccines. Many vaccines consist of the entire pathogen that has been weakened or killed. Others consist of an antigen from the pathogen. Passive immunity occurs when an individual is given antibodies actively produced by humans or animals. Passive immunity is borrowed immunity, so the effects do not last long. Antibodies produced by pregnant women can cross the placenta and enter the blood of the fetus. This gives the baby some protection for a few months after birth. Passive immunity can be used clinically to boost defenses against a particular disease. For example, if you are exposed to a disease, you can be injected with gamma globulin that contains the antibody to the pathogen to help protect you from the disease. These antibodies only last a few months because the body has not actively launched an immune response, which means that no memory cells were developed. This chart just shows the different types of immunity. So you can have adaptive immunity, which can be natural or artificial. Natural adaptive immunity could be passive or active. Artificial immunity can also be passive or active, such as an antibody transfer or immunization. Some early signs and symptoms of infection include feeling unwell, sore throat, coughing, fever, chills, nausea, diarrhea, and end wound drainage. The elderly are more susceptible to infection because the immune system becomes weaker with age. Skin becomes thinner and tears more easily. They have limited mobility, which increases the risk of pressure injuries. They have decreased circulation, which slows the response of blood to an infection and wound healing. They sometimes have catheters or feeding tubes, which are portals of entry for pathogens. And dehydration and malnutrition increases the risk of infection. Harmful immune responses. Allergic reactions occur when the immune system overfunctions. In allergic disorders, the body produces antibodies against mild antigens, such as pollen or certain foods, that normally do not stimulate an immune response. Mast cells release histamine and other substances that cause inflammation and symptoms of allergy. Autoimmune diseases occur when the immune system responses are directed against the body's own cells. HIV is the virus that causes acquired immunodeficiency syndrome, or AIDS. HIV infects helper T cells. Destruction of these cells seriously impairs immune function, increasing a patient's risk for infection. When certain mutated genes are activated, normal cells are converted to cancer cells. These cells multiply in an uncontrolled way, crowding out normal cells. A single cancer cell can form a mass of identical cells, or a tumor. Some cells of the tumor may break away and may be carried by the blood or lymph to distant tissues. This spreading to other parts of the body is called metastasis. Cancer cells frequently evade the immune system. Finally, graft rejection. Transplanted organs have foreign antigens that stimulate graft rejection, which is when an immune response in which helper T cells destroy the cells of the transplant. Cancer occurs when cell division and growth is abnormal. Cells reproduce for tissue growth and repair. Cells divide in an orderly way. When cell division and growth are out of control, a mass or clump of cells developed. This is called a tumor. There are benign tumors, which do not spread to other body parts, and also malignant tumors, which invade and destroy nearby tissues, and they can also spread to other body parts, which is known as metastasis. A biopsy is often needed to diagnose cancer. A biopsy is a procedure in which a piece of tissue is removed for testing. Per the American Cancer Society, there are several signs of cancer: fever, fatigue, unexplained weight loss, pain, skin changes such as a new mole or changes to an existing mole, changes in bowel or bladder function, a sore that does not heal, thickening in the breast or scrotum, indigestion or difficulty swallowing, nagging cough, or hoarseness. Some risk factors for cancer are advancing age, tobacco use, radiation, infections, certain viruses and bacteria increase the risk of cancer, immunosuppressive drugs, alcohol, hormones. The female hormone estrogen and progesterone are known to increase the risk of breast and uterine cancers. Diet and obesity. Obesity is linked to postmenopausal breast cancer and cancers of the colon, rectum, uterus, esophagus, kidney, pancreas, and gallbladder. And finally, the environment. Cancer treatment depends on the type of tumor, its site and size, and if it is spread. Surgery can be done to cure or control cancer or to relieve pain. Radiation therapy destroys certain tumors, shrinks a tumor before surgery, destroys cancer cells that remain after surgery, controls tumor growth to prevent or relieve pain. Healthy cells are damaged with radiation. Skin changes occur at the treatment site, such as drying, itching, swelling, peeling, redness, blistering, and hair loss. Hormone therapy involves drugs or surgery to remove hormone sources from the body. For instance, to treat breast cancer, drugs are given to block hormones from the ovaries or the ovaries are removed. Finally, immunotherapy helps the immune system fight cancer. Some guidelines for caring for a resident with cancer include reposition at frequent intervals, offer back rubs, provide rest during ADLs, observe skin on a regular basis, keep skin clean and dry, provide regular mouth care, provide frequent small meals, encourage fluid intake, weigh resident on a regular basis, and encourage participation in activities. Autoimmune disorders occur when the immune system attacks the body's own healthy cells, tissues, or organs. With celiac disease, when gluten is ingested, the immune system causes damage to the small intestines. Signs and symptoms include abdominal bloating and pain, diarrhea or constipation, weight loss or gain, and fatigue. With Graves' disease, the thyroid gland produces excess amounts of thyroid hormone. The person has irritability, problems sleeping, weight loss, sweating, muscle weakness, shaky hands, and bulging eyes. With Hashimoto's disease, the thyroid gland does not produce enough thyroid hormone. The person has fatigue, weakness, weight gain, sensitivity to cold, muscle aches, stiff joints, facial swelling, and constipation. Lupus can cause damage to the joints, skin, kidneys, heart, and lungs. With lupus, a rash across the nose and cheeks is common. With multiple sclerosis, the myelin in the brain and spinal cord are destroyed. Nerve impulses between the body and the brain are not sent in a normal way. Functions are impaired or lost. Finally, with rheumatoid arthritis, the lining of the joints is attacked, causing inflammation and swelling. Treatment of autoimmune disorders is aimed at relieving symptoms, replacing needed hormones, and suppressing the immune system. Acquired immunodeficiency syndrome, or AIDS, is caused by the human immunodeficiency virus, or HIV. HIV attacks the immune system, destroys the body's ability to fight infections and disease. HIV is spread through blood, semen, vaginal fluids, rectal fluids, and breast milk. Possible signs and symptoms include flu-like symptoms, swollen glands, headache, fever, weight loss, night sweats, difficulty breathing, cold sores, and changes in mental status. Guidelines for caring for a resident with HIV or AIDS include practice standard precautions, disinfect surfaces in the resident's room and bathroom on a regular basis, discourage visitors who have an infection or cold from visiting, observe resident skin on a daily basis, keep skin clean and dry, turn every 2 hours, provide rest periods during ADLs, provide frequent mouth care, and measure and record weight.